Patients and patients with a lot of bronchiectasis or chronic bronchitis, they build up large amounts of secretions, and some of them cannot get them all up. So you may be having to do nasal suctioning on them, oral suctioning. If they have trachs, you may be suctioning frequently. You know, the one thing you need to understand, if your patient is doing poorly with a trach and you're not able to get anything through secretions, then you're going to have to do lavage, okay? Lavage begins with saline and a bag valve mask. Now we can do the same thing through an ET tube, but we will take the bag valve mask. We will, what they call hyperoxygenate with really good deep breaths into, okay? Have your suction ready. Instill a cc of saline or 2, and then you're gonna bag some more. And when the patient starts rattling and coughing and coughing and coughing, which they will be, you will be suctioning a lot. You will be instilling the suction catheter in, and you will be pulling out a lot, okay? Because this is what happens when they get plugged. When those mucus is so thick that they get plugged, you will have to be doing frequent suctioning and lavage. It's called, they used to call it pulmonary toilet. We call it lavage, okay? And that's how it goes. You may have to repeat the suctioning with the saline and lavage, okay? Remember, it's saline and bag. Patient may not need oxygen most of the time, but during the lavage episode, you will need to have a bag valve mask handy, okay? Have it at the bedside. Every trach needs to have one at the bedside. You also need to have an extra trach there, and you need to keep doing this until that stuff loosens up and the patient's able to get it up. Okay, when it starts to get thick, and it starts to get thick, you need to be careful and watch your patients for plugging, okay? Now, if you suspect plugging, you can go in and have them do a chest x-ray. Make sure that your patient's taken care of as far as their humidification. If they need to be on aerosol, but they don't need the oxygen, we can put them on aerosol at 21%. And that aerosol will keep them from getting those mucus plugs. We just need to work together and communicate so that your patients with these issues do not get the mucus plugs, okay? We have ways and things we can do to keep them from getting plugged.